When I was in medical school, I got really comfortable closing my eyes and picturing a wide variety of rashes and skin conditions. From eczema, psoriasis, to skin cancer, we spent a lot of time talking about how these conditions might present. We also spent a lot of time learning about how to diagnose and how to appropriately treat these conditions. I never really thought about how what I was picturing could be really different in people with skin of color, even though I myself am a person of color. It wasn't until I was taking my own daughter with really significant eczema to her doctor that I realized that our conversations and my concerns were really different from a lot of what I had been taught to focus on in medical school. Instead of really worrying about the eczema itself, we were talking a lot about the loss of skin color from her eczema and whether or not that skin color would come back. Would she ever have even skin tone again? And how long would that take? I'm Dr. Neha Pathak, and you're listening to Health Discovered, a podcast by WebMD. When we think about skin and hair care, we all pretty much know that there isn't a one size fits all remedy for all skin types and all skin tones. But many health professionals haven't been taught to tailor our conversations and counseling to the specific and sometimes unique concerns that conditions like eczema, psoriasis, or alopecia might raise for people with skin of color. So today, board certified dermatologist, researcher, and published author Dr. Shoshana Kindred of Kindred Hair and Skin Center joins us to talk about what led her to create her own skin and hair center, the education gap in medicine when it comes to ethnic skin and hair care, and the skin and hair conditions that commonly affect people of color. Did you notice when you were training that, there's one type of skin that we're really paying attention to and a whole other spectrum that we're not even really learning about? Did you notice that in training?
So I'm really, really lucky, kind of, sort of, but not really, because I trained at Howard University, right? And so what I noticed is we would read a research article,
Mm,
and then our conversation was, okay, how does this look in blacks? How does it look in Asians? How does it look in Latina? Not too much of a difference there because Latina really is white, blacks, and everyone in between, but there was a difference for Asians. And that's what was different. And I thought every institution did that.
mm,
Right? Because the textbook had pictures of all white skin. Obviously, there's tons of non-whites in America, so every institution is supplemented. It wasn't until I graduated. No, actually, I got a hint when I took the boards, and not a single question was skin of
mm,
color. That was
mhm,
like where when I'm studying, there's nothing to do with stuff where blacks really, really carry the burden of. But then I took the
mhm.
boards. That was another hint, and then in practicing and just seeing what my colleagues were doing, it was like, no, no,
Mhm,
and really good people, great
mm.
intentions, care about their patients, but it was just the curriculum, the training that was lacking, and patients can feel that. That's the other
Yeah.
thing. We can't insult the intelligence of our patients. They can tell if you're a smart person, but you just don't get it. And I
Yeah.
think that's why a lot of times um, Black patients in particular would seek those of us that train out of Howard or those with the quote unquote niche or specialty in skin of color, which I don't consider myself a skin of color expert. I just consider myself a competent dermatologist. But
Mhm.
some people have to carry that title for patients to know we get it, right?
Yeah.
I can treat anyone who walks through our door.
Yeah, no, I think that's such an I'm just thinking back to medical school myself and thinking about like you, I actually didn't have much exposure to derm during training, and
Mm-hmm.
I'm internal medicine in primary
Mm-hmm.
care. So we saw we learned about the general rashes and the eczema and the, psoriasis and other things like that, topical dermatitis. So like, I'm sorry, contact dermatitis and things
Yeah.
like that. Um, but it was really when I had kids and they had skin
Mm.
issues that I was sort of
Mm-hmm.
like, every time I took them to a dermatologist, it was, we didn't really talk about the hypopigmentation that happens. So that means like
Mm-hmm.
the loss of their skin
Mm-hmm.
tone that will happen in certain areas, or the
Mm-hmm.
hyperpigmentation in certain areas. And then
Mm-hmm.
how do I manage that?
Mm-hmm.
So I think you're so right that, everyone I saw was very well meaning, but
Mm-hmm.
didn't necessarily get to some of the questions that were most concerning for me and sort of my kids. I have a tween, so she's very conscious about,
Very conscious.
right?
I have a 12-year-old
Like,
year old. I get it.
yeah, yeah. So it's just sort of like, is this so she has really bad eczema, so she has all these patches on her face that have lost their pigment. So for a while we were like, is this, and we have a family history of vitiligo,
Mm-hmm.
and where that's where it's an autoimmune condition, where, right, so where people that have it, the your body's actually destroying your skin's pigment producing cells. So we were
Excellent
really
explanation. Mm-hmm.
I'm trying with the derm. I'm like, let me make sure I say things right.
The pressure was on. A dermatologist was listening to your explanation.
So do you experience things like that? What is it that when patients come to you, they're like, oh, thank you. You're finally like sort of talking about something that may have been missed. What are some of those things that people come to you and are just so thankful that they're talking to you about it?
Unfortunately, it happens every day and all the time. And at first, it strokes your ego, right? You're
Mhm.
like, yeah, I know I'm good. I connect with that patient. But after a while, you realize, you know what? No, you're not good. You're normal. It's just you have some culturally incompetent colleagues, right? And it kind of
Mhm.
pisses you off a little bit. Everybody should just go to the closest dermatologist to them. But instead, I have people flying across states and things like that when for psoriasis, right? For eczema, for dandruff. You do not require anything more than your average dermatologist for those
Mm.
conditions. So hair is a big thing. Um, First off, most derms don't like hair. I took an L for the field, right? That's my passion. But then they don't know black hair. Or how
Mm.
you mentioned how it's important to you, the discoloration. It's very underwhelming, the emphasis of discoloration in like our textbooks, etc. Right? But things that are quite important, such as erythema, we have a whole, we have chapters on it, and it's covered within other chapters, for example.
Mm.
Um, by the way, you might be describing pityriasis alba on your daughter's face, but
Yes.
we'll do a
Yes.
curbside.
Correct. Yes,
Um,
that's exactly. That's what. Yes.
okay,
Your brain always goes to what's the thing that I'm the most concerned about, and then you're right. It's pityriasis alba, and
okay, it was, yeah.
yes, yes.
But there's no excuse, right? So I had no clue what a tanning bed was before I started derm residency. And I grew up in California and I still had no clue what a tanning bed was, but I was expected to know about it, expected to understand that patients get a euphoria. That's why I can't just say stop. I had to explain that I understand that they feel good about it. I understand that they think that a base tan is healthy, right? I was
Mm.
expected to be able to connect with my patients. There's just no excuse. I'm a Christian. I'm supposed to understand that if a woman comes in with a hijab, I need to let her know, oh, we have a policy. No one will open the door without knocking first. Can I see your scalp? You're just expected to know that with your patient. I think it comes a little bit out of like human decency, knowing what's important to your patient. At the bottom, at the end of the day, you could just ask, what's most concerning to you about this? What's bothering? What worries you the most about this? Opposed to the patient feeling scared to ask or a little bit embarrassed. They might feel like if the doctor didn't think it was important, maybe it's not really important. Are they being silly for worried
Mm.
about it? I'm sure I've missed the ball on some patients too, right? I'm definitely not perfect, but it's really well known that for skin of color, that discoloration is important. So no one should be missing it.
Now, I think you bring up a really important point. While we need to sort of really make our training more robust and make
Mm,
sure that people are really thinking cultural competence, and I think and I hope from what I'm hearing from my colleagues in academic medicine that they're really trying to look at that, that
they are.
patients, that people, when you go to your doctor, don't be scared to say what's important to you, because sometimes you're actually training your doctor, you're
Doctor.
training your healthcare
Mhm,
professional on
mhm,
how to take care of the next patient. If you
mhm.
let them know that, hey, as a person of color, this discoloration is really bothersome, or this is something that I'm concerned about. Like just a simple question like, do I need sunscreen? Like a lot, I didn't grow up ever being told or ever even thinking about sunscreen.
Mhm.
And then one day, too much sun, and I remember with my friends, I was like, something's happening to my skin. I've got, like, stuff coming off of it. What is this?" And that was the first time that someone was like, "You're peeling, that's sun damage." So,
That
w
happened to me. I wonder if we all have that story.
So how do you talk to your let's talk about some of these simple things that
Mhm.
is how do you talk to your patients of color about things like sunscreen? Is it important? Is the same data there that just like with, you know, lighter, less pigmented skin, you have a definite relationship with UV exposure and skin cancer? Is that the same thing for people of color?
No, and I'm glad you asked it like that. I think some people are just taking data, that's been present for years, erasing the word white and then writing in the word skin of color, and it doesn't work like that, right?
Mm.
The average Black person has the SPF of 13.4, right? And then higher if you have more melanin, lower if you have less, and that's constant. It doesn't wear
That's
off after
natural.
2 hours, right? So there's some protection there. At Howard, and please know, we saw a ton of Black patients. I had two Black patients with the basal cell carcinoma and or BCC, and that's the most common skin cancer. It's like 4 million cases a year, and I saw two in 3 years in a
Mm.
Black person, and probably a good 1,000 cases in my white patients. So it really has to do with anti-aging, believe it or not, for Blacks and wearing sunscreen. We age as well, we just age differently, right? More sagging and discoloration. So when someone comes in to help even their skin tone, we're talking sunscreen. But
Mm.
I don't want to say lying, but I'm not misleading them to think that I'm recommending sunscreen for skin cancer. If they get skin cancer, it's typically, uh, let's say, from a wart from hidradenitis suppurativa. Those are two ways you can get SCC or squamous cell cancer, or melanoma on the hands, feet, nails, acrolentigenous melanoma. Basal cells is not number one for Blacks, but when it does, it is on the head and neck. So usually you can see that. It's not hidden like
Mm.
melanoma. So for Blacks and cancer, the solution isn't sunscreen, and it's not even annual skin checks, it's awareness. So, you know how you mentioned you didn't grow up knowing to wear sunscreen? We don't grow up knowing to get a suspicious looking mole checked out,
Mhm.
that funny little brown streak in our nails checked out.
Mhm.
That's where the solution is. That's where the prevention is awareness. Now, yes, wear sunscreen for anti-aging, um, and we just wish they would. I don't know if I should say this, but stop putting so much chemicals in our sunscreens. Because we're
You can
thinking
say
we're
it.
seeing very mild allergies with sunscreens that could be causing some thinning of the hair. We're not sure.
Mm.
We're trying to figure out, but just like keep the junk out, right? Just
Mhm.
block the sun and keep the junk out.
I love that. I think there's so many things there to unpack again. You are like a wealth of information. I think that that is
I'm
so
that
the
nerd that sat next to you in high school.
So I think, yeah, I mean, one that when we're talking about skin of color, there is some natural sun barrier there. And that is pretty effective or pretty good with regards to skin cancer, but the anti-aging benefits of things like sunscreen, covering your face, staying out of sun, in the times of like the most intense rays of the
Hmm.
sun, those are important for all of us because of skin aging and other types of pigmentation changes and things that we're all concerned about. I
Hmm.
think that your point about really the awareness of getting a rash checked out is really an important thing culturally, because I think that there's culturally uh, kind of something holding us back sometimes. I see it in
Hmm.
my elders a lot too, where it's just
Hmm.
like, I'm gonna give this
Some
a month
time.
or 2
Right.
months or a year before I talk to somebody about it.
Hmm.
So
Hmm.
really that awareness of rashes, moles that are changing, really important, is particularly hands, feet, soles of our feet, face and neck need to be checked out.
Yes, absolutely. And for derms, we're feeling really important right now considering monkeypox, right? So everybody
Mm,
wants us to take a look at these bumps. And what sucks is, right, this is also mosquito season and flea season, etc. Um, so it's a little bit easier to convince people right now, right, to see their derm. But you're right, culturally, no, if it was on the skin, it wasn't that important. But let it be shortness of breath, right? Let it be tingling in the arm, um, or whatever, and they ran straight to the doctor, but not so much for the skin.
so I'm glad you mentioned monkeypox. So because that is on a lot of people's minds. So what is that looking like? What are you seeing in terms of people of color, in terms of, less pigmented skin? Are you seeing a lot of cases?
Not yet. I'm in Maryland, and so our cases are, I think, still less than like 200, for example. But for derms, we see the differential diagnosis. We see all the lookalikes too.
Mm. Mhm.
So we had a case. I'm pretty confident it's folliculitis. We tested it for folliculitis, and we have to wait 2 days to get the test back, a bacterial culture. But we don't have the test for monkeypox, and I think health systems are still figuring it out. I don't think our health department knew what to do when we called, and then the poor, nurses and PAs at the urgent cares are supposed to fix it all. So we
Mm.
just ordered the test ourselves so that we can test our patients. We know that if there's going to be a zebra, an outlier, an unusual looking monkeypox, derms were the one who'll catch it because they don't get the prodrome,
Mhm.
right? I can't ask, oh, have you had a cold? Any URI symptoms or whatever? Is this the version we're getting is not following instructions.
Mhm. Mhm.
So it's just for our due diligence, we should be ruling it out like pityriasis rosea and an RPR. It's probably PR, but we still have to rule out syphilis, just doing our due diligence.
Mhm.
So I think we're going to get the most lookalikes out of everyone, and we're at our office. We're prepared to just test it ourselves.
Right, interesting. So, yeah, so I think if somebody has a concern, show up, get it checked out. There's a lot of other things it could be as well. So it's good to be on the safe side. I would love to talk to you about hair now, because that is sort of where you're really spending a lot of your time. And particularly when it comes to things like hair loss in the Black community, in men and women. So, what is it that you really want people to know when it comes to hair loss and what can be done about it?
So if I could just boil down my burning desire for what I want people to know, it's one is alopecia is not a diagnosis. Alopecia just means hair loss, nothing more, nothing less. Right? That's like saying
Mhm.
cough. I don't know if you
Mm-hmm.
have acid reflux GERD or if you have COVID or if you have lung cancer. You tell me nothing.
Mm-hmm.
All right. And there's like 15 different types. So that's one. The second burning desire for everyone to know is that biotin does not work. I need to know who was biotin's publicist because whatever they did back in the day has been working decades later. Biotin does not work for hair loss. And as you know, it messes up lab results.
It's funny that you said that my husband does not take any supplements. He's also he's a gastroenterologist, but we have a lot of biotin at home. There's a lot of prayers around the biotin. So thank you for saying that.
I'll save you a couple of coins. You don't have to resupply your biotin.
That's
Um,
great. Yeah.
yeah, for the Black community, though, those are just my burning desires, right? That was for everybody.
Mhm.
For the Black community, though, um, it's important to know to, if you have hair loss, to seek treatment by a dermatologist that specializes in hair loss early, right? As Black women, we're pros at camouflaging hair loss, whether it's braids or weaves or wigs or swoop or what have you. And everyone is thinking they're the only one with hair loss. So to really seek treatment early, and the way to tell is just part your hair down the center. And
Hmm.
if you see the part start to widen, then you might have
Mm.
some thinning, and you should see a dermatologist that specializes in hair loss.
And I'd love to sort of jump from that topic to personal care products, 'cause as you mentioned, we're all sort of like experts at, or, particularly women,
Hmm.
and then women of color at camouflaging. I like how you said that, or trying to find our own solutions. But and there's always some personal care product for whatever ails you. It's out there, it's being marketed. And like you said, it concerns me because these are a lot of chemicals that we're putting onto our bodies, into our hair. We already know with other health disparities that people of color, particularly Black people and Black patients, are at higher risk for certain cancers, heart disease, diabetes, and some of that may have some environmental connection. So, what do you talk to your patients about when you're talking about personal care products and protecting yourself?
This is, gosh, such a wonderful point that you're bringing up. So, there's a couple of facts in what you just said. One, for Blacks, we know that hair products that target Blacks, particularly Black women, are more likely to have carcinogens and endocrine disrupting chemicals. So that's one. And we know that breast cancer for Blacks has really increased dramatically in the last couple of decades. Infertility is high, diabetes, etc. All stuff related to EDCs are high. We also know that Blacks are more likely to leave-on products, right? So for
Mhm.
most other cultures, products are applied and then rinsed out. Whereas easily in a daily routine, we can apply two leave-on products and then also not wash our hair for another week or two or more, right? If say we have braids.
Mm.
So we're actually doing a study. I hope the study is wrong, but we're looking at the chemical levels of phthalates in the urine of Black women with and without CCCA, and then looking at their exposure to phthalates. So let me back up. CCCA. CCCA is centrifugal cicatricial alopecia. Central because it tends to form in the center of the scalp. Cicatricial meaning it starts small and it spreads. I'm sorry, centrifugal means it spreads, and cicatricial means it's scarring, and then alopecia, hair loss. If you
Mm.
look at all forms of hair loss, there are more Black women with CCCA than all other forms combined. Like that's the one. So yes,
Wow. Mhm.
androgenetic is number one in the world. That's the hormonal one, but CCCA is number one in Blacks. We're suspicious that a lot of these chemicals, whether it's relaxer, a leave-in conditioner, a gel, hair grease, whatever, we're suspicious that they could be really activating some of the genes associated with CCCA, then getting absorbed into the body, wreaking havoc, and
Mhm.
then being, spit out in the urine. Uh,
Mm.
so, what I tell patients is you can put anything you want in your hair, right? My patients still have to look fly, but
Mm-hmm.
you only put what I give you on your scalp.
Mm.
And I'm hoping that that reduces some of the absorption until we figure out exactly what chemicals to avoid, which ones are truly are inert, which ones are good. And it hasn't really been studied that well. There's a few of us who, with our little engine that could, right, little private practices are trying to figure
Mm-hmm.
it
Wow, that's amazing. We would be so curious to see what your results pan out looking like. That's really interesting. It's funny. We had a previous episode where we were talking about hygiene practices and culturally, how things might be different in different cultures.
out. Mm-hmm.
And I was mentioning that for me and the way I grew up, oiling your hair was just like critical. Like
Tuesday, right? Normal.
that's right. Exactly. It's like right now, like I was just looking at my, the image and I've got some flyaways, unacceptable. If my mother was here, unacceptable. So, yeah, no, I think that, there's an important thing for us as doctors, as healthcare professionals to be aware that different cultures use different types of products and what effect that may have on health. And then I
hmm
think it's really important for us culturally to share that information with our healthcare professionals so that they learn that this is something that I may need to ask about.
hmm You're absolutely right. Are you? Maybe you're not. I'm a little insulted that they took and how like culture been putting oil and whatever on our hair for like millennia, and then they're making it a rage and calling it slugging. Like, no, sis, this is not new. This is not new.
Uh, there's a whole other podcast episode of where I get personally, yes, take personal. I'm like, yes, turmeric. We do know, yes, deep breathing exercise. Yes, these are
Yes,
yes, oiling the hair and skin. Yes, that.
not new, not new, not new to us, I guess. So there you
Yes,
go.
that's right. Well, is there anything else? There's one thing that I wanted to ask you about. I want to be mindful of your time too, is, creams that lighten skin color.
Mm-hmm. Mm-hmm.
And people, that are clearly more people of color interested in things like that. I know that in India, there's a huge industry of
Mm-hmm.
lightening products. And there's so many, as you mentioned, just concerning chemicals in those products. Um, Not to mention just what that means mental health wise if you feel that you need to do something like that to feel more attractive, etc. What do you think about those products? How do you counsel around those products?
So that's a very common thing, and we probably here have 101 things in our office alone to lighten dark marks. So for patients, I tell them to look at the breasts, the skin on your breast, under your bra. That's your normal skin. We're not going past that color, right? Um, we use bleaching products like hydroquinone for really dark areas and non-hydroquinone products that are either plant-based or protein-based. Lasers, we do it all, but we
Mhm.
do not go past your natural color. And the reason why we
Mm.
still treat it, even though we don't believe in over whitening the skin, we treat it because that's important. Insurance doesn't think it's important, but it's actually quite important to have a nice, even skin tone after acne, right? You get a
Mm.
mosquito bite, and now you look like polka dots after,
Mhm.
it's Christmas and you still have those dark spots. So I
Mm.
understand normalizing the skin color, but the very first appointment, the patients know uh, what our goal is. And while what the patient want is very important, they would have to
Right.
find another doctor if they want me to
Right.
lighten their skin beyond their normal natural color.
So interesting. That's a great point. So thank you for pointing that out. We started this discussion talking about how even skin tone is really important to all of us. And so
hmm
whatever we can do sort of safely to achieve that is also important.
Very much so. Very much so. I think with
Any
hair and with this, there's like you said, in India, a whole industry where they'll sell our patients anything, right? So now there's what is it? IV glutathione, and that's not safe. I don't know how it's legal. Where you're getting an IV to lighten your skin. That's a little bit too far.
Mm. Mm.
Mhm.
Well, I am so thankful to have had the chance to have this conversation with you, to learn more about you. Anything you wish I had asked you that we didn't touch on?
Thank you for having me. Can I tell you, I did not realize the podcast had started. It was just such a natural, it was such a natural conversation. And then at some point, I was like, oh, this is it. We're doing it. Um, just, I would point out that we're pretty savvy that people will try to sell hair loss patients anything and, buyer beware, but it's not always just in money. Sometimes they're trying to buy your likes and your clicks and your shares and things like that. So not everything posted on social media, no matter how charismatic and
Mm.
convincing it is evidence based.
I love that. That is such an important point for where a lot of people are getting health information. So critical to not just look at the likes, but think about the evidence.
Exactly.
So ultimately, we know that there's no one skin fits all approach to caring for skin and hair. This means the conversations we have with health professionals also need to be tailored to address our unique questions and concerns. So if you feel like one of your major questions is not being addressed, it's time for you to educate your health professional about what's most distressing to you and what you and your healthcare team can do to manage it. You can learn more about Dr. Shoshana Kindred and her Hair and Skin Center at kindredhairandskin.com. Thanks for listening to Health Discovered, a podcast by WebMD. I'm Dr. Neha Pathak, Chief Physician Editor for Health and Lifestyle Medicine, and I want all skin to have the right medical visibility and support. See you next time.